the long-term effects of cocaine. Part of that reason is because the term crack baby itself wasn't actually really coined kind of until the 80s. So, and we remember these days, right, in the 80s. So cocaine is an addictive stimulant derived from a coca plant. Here's a picture of the coca plant. It's derived from the leaves, the coca leaves. And these are, the coca plant has been used for centuries, both for medicinal and for recreational purposes. Peru, for example, it's used in Peru for altitude sickness. So they'll take the leaves and chew the leaves and put them in the side of their mouth for altitude sickness. It's also used as an anesthetic, hence lidocaine, benzocaine, and so forth. So prenatally, it can lead to premature birth, which in practice, that's what I've seen more often. Known pregnant mommies that were using cocaine, they have come in either in premature labor and or with placental abruption, which we talked about earlier, where the placenta pulls away from the wall of the uterus. They can have miscarriage, they can have fetal death, they can have IUGR, which is that intrauterine growth restriction, where they're smaller babies. They can also have birth defects, and there's a wide variety. They can have brain abnormalities. They can have an abnormal EEG, which is the test where they put the stickers on the head and look at the electrical activity of the brain. They can have heart defects, gastrointestinal defects, limb defects or abnormalities. One other defect in particular is called a cloverleaf skull. This is a picture of that here, a known association with cocaine. As you can see, it kind of looks like a clover. And then this cutie here has hydrocephalus, which is the fancy term for water on the brain, which is also somewhat of a misnomer because it's not water, it's